morning. I'm Gerald Fried. I'm a professor of surgery and previous chair of the Department of Surgery at McGill. I'm also currently Associate Dean for Education, Technology, and Innovation at the Faculty of Medicine and Health Sciences and the Director of the Steinberg Centre for Simulation and Interactive Learning.
How has surgical education evolved with the integration of technology, like simulation and virtual reality?
Well, surgery is a procedural art, a performance field. So we should learn from other elite performers and create an environment where all learners at all levels can practice, receive feedback, and monitor their improvement. The evolution of surgical education has brought us really exciting new technologies, such as interactive online learning, serious games, virtual and augmented reality, and high-fidelity simulators. And we're really excited about offering not only the technology, but also the expertise to incorporate these into our training using principles of adult learning and instructional design.
What would you say are unique learning opportunities available to students in the program, focused on surgical education and training?
We have a variety of surgical simulators available at our simulation center, as well as in situ simulation opportunities within the teaching hospitals. And the goal of these are to create learning opportunities in virtually all the CANMED roles that our trainees and practicing surgeons are responsible for. So some examples are we have standardized patients who are professional actors, and they allow us opportunities to practice and improve our communication and professionalism skills. We have developed some interactive, immersive online learning to put our procedural training into context and to prepare for our in-person simulation sessions, as well as to reinforce those sessions as reminders afterwards. We have a variety of part task trainers to allow our learners to master procedural skills. We have virtual reality technology to create a truly immersive experience where our trainees can practice and receive feedback on their performance. We have augmented reality headsets where an expert can observe a learner and guide the learner as they're doing a procedure, even if they're at a great distance. And this is done in real time. We also have an assortment of what we call high fidelity mannequins, which look quite humanoid, and they're essentially like robots. And it allows us to create scenarios of an acute deteriorating patient where teams can practice managing these complex clinical problems and learn their leadership skills and communication skills at times of stress. As well as, more recently, we've developed what we call serious games, a gaming platform where we can create a scenario of a deteriorating patient and ask our trainees to practice their decision-making as the patient deteriorates in real time.
Can you explain why simulation-based learning is essential for developing safe and effective surgeons, and how students can benefit from it?
Well, if you think about it, in the clinical setting where a lot of our teaching is done, the patient is always central, and everything we do has to ensure that patient management is done safely and efficiently. In contrast, in simulation training, the learner is central. So skills can be acquired and mastered in an environment that's truly safe, where mistakes can be made, they're acceptable, as long as we learn from those mistakes. And we actually give our trainees a chance to practice getting out of trouble where patients are never put at risk. The other thing is, in the clinical setting, we're a bit at mercy of what comes in through the door. Our curriculum is defined by the case mix that our trainees see. Unlike this, in the simulation setting, we actually have total control of the curriculum. We could define the learning goals. We can recreate a clinical problem in a truly simulated environment. We could standardize it, and we could also standardize the evaluation around that task.
How can a graduate program in surgical education prepare students for leadership roles in training the next generation of healthcare professionals?
Graduate students in surgical education that are working in simulation really get an opportunity to take a deep dive into educational principles. And those are principles of adult learning, of professional education, and lifelong learning. And that's a bit different than classroom education that a lot of educators learn. We also give them an opportunity to really explore and master the concepts of emerging educational technologies. And these are changing in front of our eyes. And it's hard to believe, but we could have a conversation with an avatar in real time using artificial intelligence. So we can let our students learn about that. We could teach them how to create curricula for adult learning, how to develop assessment tools, how to validate those assessment tools, and truly create expertise in surgical education that can serve as their academic focus throughout their career. For clinicians doing this graduate program, it's particularly appealing because surgical education is something that can be done at a very high level by clinicians who are also busy in their surgical practice. And that's a bit different from a lot of fundamental research, which is very hard to manage and keep up to date with while you're busy clinically.
Finally, do you have any messages to prospective students who would be interested in joining the program you would like to share?
I think surgical education is a fantastic field. There's huge amount of demand. I get calls regularly from other academic centers asking if we have anybody who can take leadership roles in surgical education. And those include clinician educators as well as PhD educators. So I really think that there's lots of career opportunity. For someone who's really interested in technology, it's quite an exciting time. The explosion of technology is just happening truly in front of our eyes. So I think that that's really fun. The other thing is that we really are unique at McGill because we have a simulation center that is truly one of the leading simulation centers of the world. We train 18,000 learners a year through our simulation center at McGill. And we have an opportunity to offer virtually all aspects of adult and professional education to our learners. So what really limits them is their imagination. If they have an exciting idea, if they want to pursue thesis work in surgical education, there is an opportunity that I think will really pay off. So I encourage people to explore this field. Feel free to contact me or my colleagues if they want more information, and take the dive.